Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello, how
Hello.
are you?
I'm super good.
You
And how
look
are you?
good.
Oh, thank you very much. I'm feeling good. You look good.
Yeah, I love the background. It is so calm, and I feel so relaxed just looking at the background.
Thank you. It's my paintings, so I really appreciate you saying that.
Wait, you painted those?
I paint. I do a little bit of photography and play some music, and yeah, I mean, I try to be well rounded.
Wow,
Oh,
I love it. I didn't know that those were your paintings. Wow.
surprise! I don't know if you can see.
Uh, we'll take a look after our live. I want to take a in detail look and want to know more, but because I didn't know the photography and the music, it's very interesting. So let's start. Let's talk about health. So let me introduce you. So this is Michael Pearson, and he's a massage therapist, MMT. He's practicing lymphatics, doing so many things. He's an artist, photographer. He's into music. I'm getting to learn a lot. So I wanted to tell everyone that we met at a lymphatics workshop last year in Texas. I remember you were from Arkansas,
Yeah,
right?
yeah.
Yeah. You were like two tables behind. Yeah, I remember. It was very very fun. Very less, quite less people, and I'm happy to say that I'm in touch with like three of them, and I'm looking forward to having them on this show as well. So it's good. Thank you so much for being a part of
Oh,
it
yeah.
and removing the time and just talking about health.
Oh, yeah. And so you do a lot of lymphedema work, is that right?
To be honest, lymphedema, I've had a few cases. I am more working at an orthopedic outpatient. So
Okay.
if I get a case, I'll like I'll grab onto it and I'll not let go because I really like the experience, but not a lot of patients around where I work.
Yeah.
But I like to keep my hands dirty by practicing here and there on my friends or on myself so I don't lose those techniques. But yeah. Okay. So talking about health, what do you think health and fitness is and where does it come from?
Well, let's see. So I think that health is the ability to bounce back from injury or illness. So it's kind of like a layer cake of events that you do to kind of build up your reserves to be able to um, uh, you know combat those situations. All right. So it's kind of like you got to take care of all the layers to really be healthy. And so I just think about like the analogy of I think it's real popular, like mind, body, spirit, like those layers. And if you're not addressing one of those, like you're probably, I wouldn't call that healthy, right? So you could be physically fit and you could be like no illness or injuries, but if somebody cuts you off on the road and you want to like go run them off the road, like I wouldn't call that a healthy person.
Correct.
Right? Like, so you gotta kind of keep putting deposits into the energy bank of health, and kind of look for the things that are taking away, just like all the fees that you're paying, just energy wise, all the surcharges and everything that you're doing, what's taken away from your ability to heal yourself and throughout your life. Does that make sense?
Yeah, 100%. I love the way you coined it. It's like small energy pockets that you have to be very careful of. I want to know, although, what aspects or what layers do you consider? Because for a few people, since we're both in health profession, we're in the healthcare system, we understand that those layers are a lot of things. It could mean so many things, but not everyone is okay or accepts those layers. So what are those layers according to you? Like
Yeah.
physical.
Yeah, so we've got this, like just using that example of mind, body, spirit, right? So, and I think there's probably more to it, but just to like break it down. So you've got the mind aspect. If you are not giving yourself the nutrients and the mental exercises to handle the situations that you're coming across, if you're not growing your mind, you're not going to be developing many of the aspects in your life, right? And so you might also, and I would say, like I use the example of road rage. You know, if you're not able to handle situations like that, so if you're not programming yourself the way that you want to mentally, then a lot of your energy is going to go towards being mad about that thing that happened to you a couple of years ago, or so mental health, right? So you got to take care of that aspect of it, because that can destroy you in itself, right? You could be totally fit otherwise, but just be a ball of rage or something like that, just as an example. And then as from the the spirit aspect in that analogy, I think that would be more like your community. You're getting your health from your church group, or your bicycling, your club, your sports team, or whatever you do to replenish that energy that's nourishing you, your community, the people that are going to take care of you when you need it, to pat you on the back, to give you those hugs, like, nurturing that aspect of yourself. That's you need that layer, and that layer cake. And then there's the body in that, and that's what we work with, right? So if you've got injuries, if you can't lift your shoulder or your elbow up over your shoulder, and or if it hurts you to go out of the house, or if you have digestive issues, or and that's hampering your life, and you're not able to go out and see people, or live life up to the fullest of what you would like to do, then you can take you can do things to make sure that you have that kind of health in your life by staying fit and eating clean, and just adding in those little those things that add to your energy better, and kind of eliminating the things that kind of take your energy away in a bad way, or a useless way. I don't know, did I say that well?
Yeah. But it was perfect, because you explained that physical, mental, and social. That's like the whole package of health. That's perfect, because I love the way you told about community. Just a pat on the back, just a hug. That's all you need sometimes to just call yourself healthy, socially
Um,
healthy.
yeah. Yeah. And just to what I keep calling just down regulate. When you get just emotionally or just mentally out there, and you can't bring yourself back together, and then you come home to your pet, right? And your pet just grounds you, so to speak, right? And now you're present again. You need things like that in your life, and whatever you want to, however you want to manifest that in your life, it needs to be there for you to have long-term health. Did I say it well?
That's perfect. Oh, tell me, how did you get into massage therapy? Well, what did you have in mind before you wanted to do massage therapy?
Well, I always played rock and roll beforehand. I spent a lot of times just playing music and doing open mics when I lived in Austin. I went to massage school in Austin, Texas, and
Okay.
so interestingly, right out of high school, and the band I was in, we got a recording contract with a Warner Brothers company. And so, at 18, 19, we got to fly out to LA and do an album. It was a super cool experience for coming from, just living in small towns in Arkansas all my life, getting picked up in a limo, and then we ended up getting some songs in movies. And so I just wanted to pursue that for a long time. And I just ended up just kind of moving around the country a little bit and just taking kind of some menial jobs, just like washing dishes and, prep cooking and stuff while I was writing songs. And so I just kind of moved around doing that, and always had um, like massage was always kind of on the back burner in my mind. Because I loved to do it. Anytime like we'd get together with friends, I would be like working on backs and stuff, and always got good response from people. And in fact, I thought about it. Like one of my first memories was, when I was like 3 or 4, I was like sitting on my mom's back and just like using a massage gun, just like working up her back, and she was really grateful. She was like, "Oh, that feels so good." And for as a little dude, I was like so grateful that I could do something kind and nice for my mom, right? And so I think that kind of stuck with me and kind of became I don't know, a core memory of things that I want to see in my life. I want to be able to share and be kind with people. So cut to like doing music. As an artist, you want to kind of provide insight to people, and like provide an experience, a unique experience, and kind of you use that to express the things that you can't really express with words, right? You paint that picture, or capture that moment in a unique way that says something to somebody else. And then so when I started doing body work, I kind of used that philosophy with into the body work. Like when I go into a session, it's kind of like I'm starting a symphony. Like that first string, like note, just starts to unfold and becomes the story, right? Everything's defined by that first pitch, and it just keeps building and building. And as an artist, I think it's so cool because what I'm able to do just with my hands is I'm telling the story of that person to them, right? So it couldn't be more, I don't know if the word is intimate for them, because it's their life, it's their story, right? And you get to be, as a body worker, you get to be the narrator for them of the story of their life in a way. So I have so much fun just kind of, it's kind of like a one man show, like one person in the audience symphony. You just go in and you just keep the flow going, and sometimes you find things that are super important to them, and you can narrow in on that, and you can change that a little bit for them, and then just move on and just like keep the story going. And by the end, like hopefully if you did it well, they feel like they've been through like an experience. Does that make sense?
It was so poetic.
Oh yeah.
It was, I'm blown away just listening to it. But wait, the biggest question is, am I talking to a celebrity right now?
No.
Come on.
No. I think my highest like point of fame was just having I got to go to the movie theater and watch my name roll across the screen, and that was really cool.
Cool though, like living the LA life, even if it's for a little time. The limos. Now I want to be a celebrity. I'm bragging to everybody. I spoke to a celebrity.
If you want to, but yeah. Yeah.
But it's I can see the passion that you have for massage therapy, and the way you're describing it is a story in itself. And not everybody gets that joy from their work. That's really unique. And I love that your profession is so close to your heart. Is that what you're doing right now? Is that currently what you're working with?
Well, I'm not sure what you mean. I'm kind of growing my business off of those things that I love to
Right.
do. And so, once I got out of school and I started doing the body work, and I started realizing that the results that I could get with helping with pain management,
Right.
that was a whole new ball game. I didn't realize going into it that I was going to be able to be as effective as just a manual manipulator of tissue, and to be able to help people to like not get shots every month in their back, right? And to be able to like lift their arm up, like people who hadn't lifted their arm over their head in years, and within an hour I'm able to balance out that muscle to allow them to do that kind of work. And that was like, I've always wanted to be a rock star, obviously, right? So like when people are like walking out of the session and they're just like I've never been able to do this. I feel so good, right? Like going back to being able to help my mom, like to be able to help my community, it means so much to me. So that when I started realizing that, by studying harder and having a better understanding of anatomy and the way it works, that I was going to get better results with people and be more effective. But then also that was going to help me grow my business as well. Right. Like because people will talk about that, right? If you're able to help somebody do that, they're going to be out there spreading the word. So it just made it so much easier for me to build a practice, because my whole business model was just keep getting educated, keep learning new things, get more and more results for people. And because that meant something for me, and it also meant something for me, like to manifest that in my life, to like build that business that I'd never been able to have, right? So like having like being in music, it's just like a lot of downtime, right? And just a lot of time alone, just like mashing through chords and just trying to like learning those skills on your instrument. And with body work, it's you spend that time just studying muscles, and you studying the way things work, and you got to like be able to put in that kind of uh, that time just to mentally understand that how it's working, right? And so since I came from that background of spending a lot of time just doing chords over and over again, that allowed me to have that became an asset for me in body work. Right. And so so that's kind of what I'm working on now, is that I'm just trying to get better and better and understand more and more. I mean, there's so much to learn. I'm not in danger of hitting the ceiling of understanding at any point.
True. There's so many advances. There's so many new techniques, researches, with lymphedema coming, with so many new therapies, and there's movement therapy coming up. I've been speaking to a few speakers. They've been mentioning movement therapy. So there are so many more techniques and so many more um, studies that are coming up. That's so exciting to learn and read and just be up to date about those
Yeah.
things.
And that was one of the things that really grabbed me in massage school, was realizing that, within my lifetime, there have been modalities of manipulate, manual manipulation, that have just changed the course of things, that have like meant so much, just like to the whole the whole planet, right? Anybody who's got this issue can benefit from this new understanding of like lymphatic work, right? To me, it's wild to me that they didn't have the current understanding. I mean, it's not even 100 years old that they started to discover the lymphatic system. And so to me, it's exciting to think that I might be able to figure something out in manual manipulation that contributes to all of society, right? So like what a legacy to bring, to give, if you could be that kind of person, so it's just really highly motivating and rewarding.
To be honest, that's what drew my attention towards physical therapy, because physical therapy was so fresh, was so new. Like you said, it's not even 100 years old. There are so many therapies like we're learning with physical therapy that's not even what, a century old. So I was like, oh, that's interesting. What's that all about? And that drew me towards learning more about the body. And my love for biology was just like keeping me up. I heard you speak about the shots that you give on shoulders, the knee, because I have my patients getting shots every now and then.
Yeah.
Not a single patient has benefited from it. Not a single one.
Mm.
I don't know what's going on with that because I'm trying my best to get them physically fit, physically moving. What are your thoughts about those shots, and would you recommend them, or would you like to stick with the traditional protocol of PT, MT, OT?
Um, so I guess depending on what they've got going on, I guess what I tell people is that you know I want to still address the problem. Like you might, and I think that the times that people do get benefits from, let's say, getting a shot, you know, a cortisol or cortisone shot or something like that, you know, that allows them to move that shoulder, let's say, in a way that's going to work out that problem. And so
Right.
so sometimes people like get a long lasting result from that. But also if, you know, if they might just nurse that shoulder for that 6 months or whatever that they're having that benefits, and then it starts to come back. And that's what we see a lot of, right?
Correct.
Those are the people who return and still have that long-term issue. So
Yeah.
I tell people that you want to get that shot, get out of that acute pain so that you can live life, but you don't want to neglect, you know, fixing the actual problem, right? So I don't like things that allow you to live in a dysfunction, right? I don't like the beds that fold up like this so that you can be in a fetal position when you sleep
Yeah.
if you have low back pain, right? So like, you know, so for temporarily it allows you to sleep, right? Which you need. So I want those tools for people to be able to get out of pain, but I also want them to know that they need to be addressing the actual problem, which is probably, you know, those hip flexors, right? And just like they need to still be getting that kind of work done and doing their homework to alleviate so that they can lay flat if they ever need to. You know, I tell them, you know, you're at a desk all day long, you drive home, you sit, you watch TV, and then you lay in a bed that's like going to fold you up. Like these muscles aren't going to get a chance to unfold. Like you're just going to make that back pain worse. Or even like, let's see, the orthotics with the, you know, for like the high arches and the feet. And if you know, if you're having foot pain, and this is one of my pet peeves, is like, you know, people get this orthotic so that they can be out of foot
Yeah.
pain. And I'm like, well, you know, when they fit you for that, do they ever tell you about like your calf muscles? You know, do they ever address your calves? Because that's, you know, that's what's all those attachments are coming from, that calf tension. And if they're, you know, and so to me, if somebody gives you something to let you live in a muscle dysfunction, are they really helping you out? You know, or are they just like painting over the rust? Right? Is that so? I don't know. Did I say that well? Did that make
Yeah,
sense?
it did. That's what we're here for. At the end of the day, we're here to treat the root cause.
Yeah, yeah.
And yeah, if once we touch, even if the patients are old, once they're doing like weights and strength training, I have not seen them come back with pain. They're just
Yeah.
charged. And it's been 6 months, 1 year, they don't come back because it's strong. We treated the root cause. That's really well said. How do you go about addressing to clients when like they come and approach you about massage and massage therapy? How would you like educate them?
Um, when they ask like what I can do for them, or
Like what happens with their body, and how what are the changes that they feel with the various systems that are there in the body?
yeah, well, okay. So for like for as an example, one of the things that I see a lot of is hypermobility.
Right.
And so in the way that I work, I start people face up, and so it's easy to like, I can just walk in and see that their calves are super tight because their feet are just pointed straight, right? And so, and I'm looking for that optimal resting position. And so I'm like, immediately I kind of, I know like what I want to convey to them. And so, you know, and I'm checking out their hips and see if they've got an interior pelvic tilt as well. And I'm looking at, you know, do they have those distortions that would kind of lend towards hypermobility, right? And so I will, you know, and then I'm asking them, you have low back pain? Is that a chronic thing for you? And so I'm just looking at, you know, how explaining why this low back pain has a lot to do with this calf tension. And so then I will say, okay, I'll do it like a demonstration for them. I will take like my massage gun, and I'll just work on their hip flexors. And so I'm just start working on that TFL while I'm asking them about hypermobility, and I'll start talking to them about it. I was like, I see how tight your calves are, you know, were you limber as a kid and things like that. And I'll start talking about like sympathetic dominance with them. I'll be like, you know, what I'll say to them is that, you know, you're born with laxivity of the ligaments, your joints are less stable, so you're more likely to like roll an ankle or dislocate something or have a pelvic tilt like we might be noticing here, or scoliosis and things. And you know, if that hits home for them, they're like, yeah. So now they're bought in because I'm telling their story already, right? And this is within a minute of coming in on a session, right? And I'm just like, while the whole time I'm working on that TFL and I'm working my way down the quads with this massage gun, doing this deep work. And then I'm just describing how, you know, when you've had this like micro trauma from being hypermobile, you end up being pretty guarded, right? You're having to, your nervous system just gets locked in on this alert, like sympathetic dominance, right? So you're always, so people who are, and I saw an article in, I think it was Scientific American, said that hypermobile people are 50 to 60% more likely to have anxiety. And I think that tied in with that would probably be depression and PTSD. And I'm looking at like what's the cause of that, and if the body has to do with just keeping the brain upregulated, right, keeping you in that fight or flight zone, then what can we do from a manual manipulation aspect to downregulate, right? And I talk about, you know, I tell them, you know, you've heard of, there's fight or flight, and then there's rest and digest, right? And then a lot of people have heard of that. And I'm just like, well, if you are, you know, 90% stuck in fight or flight, very little energy is going into that rest and digest, right? So like that, so you might have like digestive issues. A lot of people do that are like sympathetic dominant. And then I'm like, is that a factor for you? And a lot of times, you know, if their calves are like this, they oftentimes will have like digestive issues too. And they're like, yes. And like everything I'm describing, they're like, you are describing my life. You know, I'm like, yeah, you're probably, you know, you might be kind of an overthinker. You're always analyzing. And, you know, I just describe that as being kind of stuck in fight or flight mode all the time. And they're just like, yeah, I can never relax. And so just painting that picture for them while I'm doing that massage gun on their quad. And then I'm like, okay, so check this out. And then what I'll do, I love this this demonstration. So I will be like, see, I want you to feel the quality of the sensation when I touch this quad that we just worked on, right? And I'll just pat it, right? I'll just pat it a little bit, and then I'll be like, now let's compare it to the one we didn't work on, right? And then I'll pat the other side, and the sensations that they have, the one we didn't work on is just really active, really alert, and the quality of that sensation is just so much more than the one we just down regulated. And then I'm like, that's your nervous system. This is what happens when you loosen up a muscle. It just calms down that the volume of information in this local area. And then I like touch the side that's lit up, and I'm like, this is all over. This is your norm, right? And your nervous system is sending a feedback, a fire hose of information to your nervous system, and your brain's like, I don't know what's going on, but here's some adrenaline. here's some cortisol. We're just going to keep you and get you prepared to handle this tiger in the room, right? Or whatever it is. And so, so I'm able to, within a couple of minutes, give them just a blaring example of how their nervous system is alive and present in their body, right? And how to downregulate it, right? And then I'll show them I'll do like maybe a calf stretch to like, I'll just do like, the calf stretch with your elbow, like, and just like do a PNF stretch, make them push into it and just like pull the toes up to the nose.
Right.
And I'll do a little bit of stretching with that. And then I'll show them, so if they do have that like low back pain, I'll say, okay, so this is your, optimal resting position. And, when our feet are like that and we walk, our legs come out a little bit to the side to clear the distance of the shoe and the toe. When your calves are tight here, your toes want to point like they are doing right now, and you have to swing that leg out quite a bit more to clear that extra distance, right? And then I'm like, okay, and where that's coming from is that TFL and that glute medius, right? So when you, and when we work on it, that muscle is like 80 or 90% engaged, right? So you don't have a lot of muscle to recruit in this area, so it feels weakened. And they're like, yeah, that makes sense. And I was like, so then in order to get that extra swing, you end up using your QL to like lift up your hips, right? And so now that QL is overworking because that TFL's so facilitated that you can't recruit it anymore. And when we go in and we do this massage gun, we loosen up some of that muscle and allows you to recruit it again. And it takes some of the load off of that QL, right? And that just like totally makes sense to a lot of people, right? And so now within a couple of minutes, we've been able to give them homework to and a way to help with their back pain whenever it's coming up. They now know how to, for the rest of their life, hopefully, they know how to change that thing. So that's what I love to do with clients, is find those kind of muscle dysfunctions, soft tissue dysfunctions that are going on for them, paint that picture for them, and then like send them off to do the practice. And then, because it takes a while to really get that understanding. And then, whenever it gets away from them, come back and let's do it again. Let's see what you didn't do well enough, right? And then we'll do it again. We'll get that practice. And then hopefully within like a couple of sessions with me, now they know that and they don't need me for that anymore, right? That's my goals.
You just explained my story.
Oh, with the sympathetic dominance?
Everything. Fight or flight, 90% fight or flight, everything. But you touched neural sensations, muscular, gait, the tight muscles, everything. That was awesome. I loved, wow, it was a story. You are an artist.
Oh, thanks. Well, so it makes it kind of hard because, oftentimes people don't know that I can do that. They don't know that, so like, I think, classic massage therapy, you don't really think about pain management. So kind of the thing that I struggle with is that, how do I convey to people that, that they'll come in and they'll be like, oh, I've had, I've had headaches for years, but I just want you to work on my back, and it's like, well, you're kind of missing out a lot if you don't let me do the thing that I'm especially good at. So that's my struggle, is how do I, so that's why I want to be teaching classes. I'm starting to teach classes and trying to get other massage therapists to just be doing that more clinical work. Because as I see it, and one of the things I love about massage as a business is that it's kind of low entry level. It's only a 500-hour program in a lot of states. So now you've just come into a healthcare license in a 6-month period, and and what I think is super cool about it is that if you're driven, if you want to, you can take that understanding of anatomy and you can be among the highest level of manual osteopaths, right? So like if you're doing just manual soft tissue manipulation, and if you wanted to, you can be doing work that rivals in anybody that's existed in soft tissue work, and all on a 500-hour program. And that's a pretty cool thing coming from, for a guy who's just been like chopping tomatoes all his life, and just playing open mics, to be able to like do something that impacts the world and people that well. It's a precious gift in a way, to be able to go from that level of just not having skills to just, you can build your own self up, you can build up your own business, I think that that's a really awesome experience, or ability for people to get into healthcare. And just like, you can go anywhere you want to with it. If you want to just do like sports massage, or if you want to just do prenatal, or if you want to just do lymphatic work, you can specialize in anything you want to. And I just think it's a really unique field.
Right.
You know?
I think you should give yourself a little more credit, because those cutting tomatoes, washing dishes, everything disciplined you and made you. Because I look at myself coming from a small town in Pune in India, and just not having any role model who came to United States or abroad for that matter for their studies, still got married. But I think we did something right, and staying there just made us disciplined and just be better versions of ourselves.
Yeah, I mean, I think it's those times are important, because you're growing your spirit, like who you want to be. And I always thought of it as like happiness practice, as if I can, if I can keep it together and keep my joy, while I'm chopping tomatoes, or just doing like, simple things, and then I can take that anywhere. I could be happy digging a ditch or something, whatever it is. Like, that's a skill, that's probably, I think, one of the first things you need to learn, is how to be happy doing anything, and then you'll be happy doing everything.
Yeah. True. This got me excited. Tell me more about your class, more about your business.
Well, so I'm just starting to get into like the teaching side with, that's another thing I love about with the massage. In most states, you have to have hours in order to keep your license.
Mm-hmm.
And so a lot of people they'll have some classes that they also teach. And so it's just like a whole interesting side of the massage business that you can have, if you want to have like not all your eggs in one basket, right? So if you're afraid of like breaking your thumbs, just doing manual work, you can still like develop those classes and be teaching and still, and kind of be able to make money off of your license without having to like use a lot of thumbs. So I'm just looking at, just business wise, I want to be planting that seed now, and just kind of getting those skills together and getting those classes together, so that, in 15 years, if I want to like back off of doing sessions, then I can, just teach on the weekends or something like that. Right.
Right.
Does that answer your question, or?
Are these classes online or just in person?
Right now, I'm just kind of slow growing it, just like as kind of a hobby, back burner thing. But yeah, I'll eventually try to get online, but yeah, I've just got a couple of them that are approved, and I've just got approved by the national board to be a education provider.
Mm-hmm.
And so that was exciting for me, because that was like something I was thinking about in massage schools. Like, I want to be on that national level of educators. And so I just recently got to that spot, and I'm just kind of growing that. And I've got so much to learn. It's like, where do I put my energy? Like, to me, the thing that's made business grow so fast is always trying to learn new things. I think that's probably the key to me being able to grow so fast, right? So I've been a little bit of history. I've been doing massage therapy for about 6 years. And I started doing clinical work like right out of the gate. I got lymphatic certified from close training within 2 months of having my license. I just always knew I wanted to be doing, and I thought I was going to be do that for working with oncology patients, but it ended up with just in the, I went to and got a job like working in a spa, like right out of the gate, because I was like, I need to work on hundreds and hundreds of bodies. And that's like the easiest way to do that is to go work for somebody who will give you hundreds and hundreds of bodies to work on. And so I was just doing that work and practicing it. And so I just, so I kind of made a name for myself with my hands, that I was like always doing classes, always trying to do clinical work. And then eventually when I like got my own, I just like rented a room in a salon in the area. Like people had heard of me when they saw me. They're like, you're the guy who works on you did the thing. You worked in my orbit. And so like, so like, yeah, well, like I felt like a rock star,
Yeah.
And so, and eventually I started getting clients from cosmetic surgeons in this area, and because doing lymphatic drainage, and there's not a whole bunch of people in my area who will do post-op work, and that's kind of like people will do lymphatic drainage. They'll do like a little bit inside a relaxing massage, but not a lot of people will do like post-op within like we're trained to not work on people for 6 weeks. Like in school, they say don't work on people for 6 weeks after post-op, and but then also kind of my story is like getting sort of certified in like orthopedic massage. Just came across the kind of a study on scar tissue work, and they were saying that you want to be doing micro movement up within 4 hours of surgery, right? Not like much movement, like barely, moving a quarter of an inch, right? Just barely micro movement, right? And so that got me thinking that like, not working on somebody for 6 weeks, you're missing out on a lot of health and speed that you can be. So I just started kind of just working micro, just going at 2% of what do you think would be beneficial for this tissue. And so I just started building up my understanding of how to do post-op work. And it went great. So that when that surgeon that was sending me people, when people would come back and for their post-op checkups, right? Then he would be like, wow, you're way ahead of schedule, what I would expect you to be. And I just had this one great client who was like, it's this guy, you gotta meet this guy. And so that kind of got me on their radar, so then they started sending me more and more people. And eventually, it was about 2 years ago, they invited me to move my practice into their clinic.
Wow.
And so now I'm working out of their office, and which gives me a lot of street cred, with people, saying and it's a very nice office. I just couldn't be more blessed to like just be. And I think that it's because I do that clinical work, I do that pain management, and that's what you want. And if you're offering your services to other professions, chiropractic, surgeons, there's a lot of fields that I can complement, right, with my work. And so you want to be in a place that's makes that easy for you. And so it's just like something like 90% of my clients come from them. And so I do a lot of lymphatic drainage and post-op work. And I will work on people like 24 hours after, as long as the doctor's okay with it, after their surgery. And I'm just doing micro movement and a lot of like just client education. I just talk about, the benefits of eating clean and, staying away from, fast foods and processed foods, and like how taxing that is on your system. And I just talk about like, you've only got so much resources for the day. And if you spend that by, processing a margarita, then you're not going to put that energy into healing. Right. So So it just kind of like just kind of guide them through the process and gives them kind of pointers as to like what can be beneficial for them in their healing. And then one of the things that's really powerful is that a lot of people are really scared to touch it, right? They don't want to mess it up. They don't know what they can do to help. And so I get to like go in and just show them that actually feels pretty good, and it's beneficial. So now they're empowered to do that work on their own,
Right.
which I think might be one of the best things that they get out of coming that early, is that they're not scared that they're going to just bust open or something, you know? Yeah, yeah,
You've been working with Dr. Sweatman?
correct.
Yeah, I'm looking forward to have them on my show as well.
Oh, great.
Yeah, they're very nice. I think I was speaking with someone on social media, and she told me that he's going for his trip, but then he'll be back, and he would love to do a session with me too.
Oh,
So I'm really looking forward to it.
he's you're talking about Dr. Sweatnam or Dr. Stubbs?
I think Dr. Sweatnam.
Okay.
I think both, but I think it's Dr. Sweatnam.
They're super great guys. You know, Dr. Sweatnam came to one of my classes and like gave kind of a presentation about just medical aesthetics. So kind of going back a ways, just talking about those classes. One of them, I'm also a licensed esthetician and aesthetics instructor,
Yes.
and so I teach classes for estheticians in lymphatic drainage, just from like neck up, whatever's in their scope. And I'm also trying to get estheticians to be doing more clinical work too, because if you could expect to go to your esthetician and them help you with sinus issues and all the benefits of clearing out the decongestion and clearing out the micro debris for acne and things like that.
Right.
And then also, recently, I think it was in 2019, they discovered that there's like a type of lymphatic system in the brain, which previously they didn't think that there was one. And so they call it the glymphatic system.
Right.
And so now they're thinking that that the scar tissue in the glymphatic system might have something to do with inflammatory disorders of the brain, right? So like Parkinson's, Alzheimer's, and so I'm hoping that they'll find that even that simple like protocol that like we send clients home with just doing that lymphatic work on themselves will help to clear out the congestion and clear out and help with their lymphatic system health. It's really interesting. I'm hoping that that's what they'll find, and that we'll be able to find a way to do that kind of benefit without needing medication or something like that to go to do that. But yeah, that's pretty fascinating. Sorry to bounce around like that. I can't wait for you to like be talking to the Dr. Sweatnam.
I'm pretty excited.
They have been just such a blessing for me. They're so kind and generous. Yeah.
Yeah, they seem pretty cool, and their videos, the social media, I love it. That was really cool.
Oh. Yeah.
Okay, talking about scar tissue, this is personal. This is my personal question to you. How do you treat, because when I was doing taping workshops, we were taught a few techniques, and so it's the zigzag, just micro movement, and it's the stretch, right?
Okay. Yeah. I mean, and basically that's just a way to do like, in my understanding, just myofascial release. It's just a fascial release, and so the zigzag is just a way to kind of stretch in different ways, because those scar fibers, they just lay down in any direction. So it's like. So like the crossing, the spreading, just gentle work, depending on where they're at in their recovery, right? So I even work with like people who've had C-section scars from years ago, and so there's like 9 layers of scar there, and so they might have one of the things I describe to people is that when that scar tissue is laying down, it can sometimes lock onto a nerve, and then when you move a certain way, it will shear from that nerve, and it'll feel like a little shard of glass. So there's been working on people who've had that pain for years, and we just go in and we just do that myofascial work, right? And we're just spreading that tissue apart, and eventually we can find where that fiber is, and we can just release it, right? And then once that scar tissue is gone, they don't have that pain anymore. And that's very gratifying to be able to, for me, and then for them too, I guess, you know.
Would that work on keloids as well?
So I think that it would help to spread apart like the tissue that's binding around it, but it's not, I don't think it's going to change. Like, you're not going to get that back to like, you know, 100%, right? I think you're going to have to do surgery for something like that. But I think that it can soften up that tissue around, and maybe, you know, soften up that presentation of that keloid a little bit. But towards keloids, I thought it was pretty fascinating. I will use like a dolphin unit, if you've heard of them, like MPS units, micro point current. And so they have a scar tissue release protocol where you're, and this is where I thought you were going to go about with the zigzags, but you'll have just different polarities in your units, and you just go through, and every quarter inch you just like just hold it for 30 seconds. And just from the classes, if I can recall correctly, they said that after one of the trials they did with that treatment, they saw just under 24% reduction in the keloid scar. Wow. Which is a lot of extra space to build for, you know, for your lymphatic system to travel through, and for your your veins to do reestablish, right? So I think that's pretty interesting work too. Dolphin units, that's pretty neat. Did I answer your question? Was that?
Yeah, it does. But I want to really go back and look into the dolphin, because I think hearing about it very superficially, but not in depth. But now I'm interested in knowing more about what that is.
And they have some great, you know, classes online. I think her name is Lana. She's got a whole class on lymphatic restoration using the unit. So if you do like acupressure points and stuff, you can go through with those units and stimulate those, and just kind of use them like you would acupressure.
Right.
Pretty interesting stuff.
It is.
Yeah. And I'll use those units for just vagal nerve stimulation. So if if somebody comes in for a pre-op session, I might just throw, you know, we're talking about sympathetic dominance. I want to tonify that vagal nerve, so to strengthen that. So they have a way to just clip it on the ear, and then when you put just like a TENS unit pad under the belly, and it just sends that current back and forth, and it's supposed to tonify the vagal nerve, and which kind of helps you then pull that energy away from that sympathetic dominance, right? That adrenal overload that they might have. And that's, and it's supposed to, in their training, they say that, you know, when you do that, the results from the manual manipulation lasts for many days more. They just have 80% better results 3 days later. It's pretty neat. And if it's really easy to just strap that on somebody while you're doing this other work too. So if I get a chance, I'll do that kind of work too.
What do you think about kinesiotaping for scarring, scar tissues?
So I haven't really been trained in that, but from what I've seen, I really, it's on the back burner. It's just I've had so much to wrap my brain around. There's so much things to get good at, but it seems like really good results, and it seems like you can also really mess that up if you're not trained well in it. Right. So I haven't really wanted to dabble with it without having that kind of training. But it seems like, you know, what that stretch is doing is it's just doing that lymphatic drainage. Just every time they move, it's just doing that same work. So it's just keeping that lymphatic system boosted for people for days, right? So it seems like people can get fantastic results with it. I just haven't gotten into that yet. You're gonna come back to me next year. Maybe I'll be able to say I'm doing that work now.
You know, I'm certified in kinesiotaping.
Okay, so you know how you can mess somebody up.
Yeah. But I won't do it.
No, right. yeah. So what kind of results are you getting with that? Did it, the way that I said it, does that make how you understand it?
Exactly, yeah. But like you said, there are various techniques. So one that we use is the spider web. That's where lymphatics come in place, and the spider web helps whenever you're moving. It's just contracting the lymphatics and working on that system. And the other one was for keloids or scars, like post-op, and like you described, what you do, the micro movements, is just you take small pieces of tapes and just take a stretch and just stretch it a little away from the scar. So you like place the tapes a little to stretching outwards. So it's like stretching the scar. I don't think you could do it. Definitely not like how you're doing 4 hours after post-op. And you're seeing amazing results. I don't think Kinesio is we can do this 4 hours after, but I think after a week or just acute stages.
Yeah.
So yeah, but like uh, so if this is a scar, you're just taping, just stretching and taping very close by, and
Yeah.
very light stretch.
Yeah, yeah, I definitely wouldn't do that that early. And I don't normally work on people 4 hours after a surgery. I just like I will do really light work like 24 hours.
Okay.
But kind of the premise behind that is that you know and I use the analogy of like a puppy dog lick pressure, right? Just like really light work, but that stimulation that like a dog gets when they instinctively do that kind of work, you know, they're stimulating collagen production, right? So they're speeding up that scar tissue, right? They're also moving lymph, and they're helping to regenerate the nerves that are in that area. So you know, a lot of times people are numb for weeks after like a surgery, and like one of the things that's disturbing for them is to not be able to feel their tissue, right? And so I might, you know, after a week or so, I might use like a gua sha tool to go in and help break up some of that tissue. And I give them a little bit of light homework to do with that, and help to stimulate that nerve regeneration, move that lymph, and then work on those fibrosis as well. And that's kind of a that they loved, like people love to be able to be proactive in helping with fibrosis after a surgery, because they're you know, they don't know like what to expect. So when like bumpy spots show up, they think that it's permanent, and it's very frustrating, you know, for them. So
Would it be indicated 4 hours post surgery? It's still indicated like light puppy dog patting or just moving.
yeah, I would barely do any work. Like I wouldn't use a gua sha tool
With
for
definitely
uh,
rules, but just it's indicated though, right? It's okay to touch and to move micro.
yeah. So you just have to be real cautious with it and make sure that you're not working backwards, right? But there's and that's the thing, is that if you uh, you know, if you work towards that understanding and you're getting good results with that, you can be beneficial, you know, that early, right? Some people can do that, but you know, if you're not confident with that, go in at like 1%, you know, just like barely do that work. But I've just seen such benefits for people getting the earlier they come in. And you know, I just started seeing people 3 and 5 days after surgery, and they're just like, man, I wish I had come in sooner, right? And it's like, okay, well, let's try 2 days now. So I built up to being able to confidently do that kind of work. So I would suggest like not diving right in and be like, we're gonna, you know, we're going for the gold. Like don't go for the gold. Just like, you know, go for good work. You know.
It comes with experience, it comes with confidence, it comes with years of practice, and so many people, so many clients to work on. So definitely caution before anything. True.
Sure, sure, yeah.
My question to you is, what is one piece of advice that you would give to a younger 12-year, 18-year-old Michael?
Okay. Gosh, I think it would probably be more like business advice, as opposed to I wouldn't have thought I was going to go into like anything medical at the time. Um, um, but I would say that, just keep like, dig into your understanding, keep, like now, so I started like a business as an older person, that's, like worked really hard for other people for a long time. So now that I can have my own business, I can take that energy and plug it into my own business.
Right.
And so I think that I would have said, like, just as far as business is make that money, little Michael, like do, do the thing that's going to build your business, even if you're not great at it at the time. And I think that for me at that stage, I was really worried about not doing it like the best way, right? If I was going to screw something up, I thought I was going to have like, I would like mess up my taxes and I'd be in jail or something like that. And now I'm looking at like, I was afraid to start like a 6-figure business because I was afraid of like a $500 fine for not doing like my taxes right, right? And so now I would go back to myself and say, um, it's worth screwing up on your taxes to have a 6-figure business, right? So like, even if you had like your first couple of years, if you screw that up and you have, if you have a $3,000 fine, you still have a 6-figure business, right? It's like, so not starting that business because you're afraid of anything. So with that in mind, I would say, do the work, like do the thing that's going to build your business, right? Like get those skills, set up those sessions, like make the business happen, and then figure it out, what you got to do to be like legit and everything working business wise, like later on when things are rolling for you, right? It's much easier to take those kind of hits when you got a clientele, right? So make those clients. And I don't know, but that's I just, when as an 18-year-old, like being in music, I was looking at that big prize of like, wow, in music, the ceiling for what you can do, what you can make it in music seems to be like astonishing to me. And so I was just like, I always kept that as, that was like my prize, that's what I was working towards. And so I think that if I could go back to myself at 18 and say, get yourself a trade skill, right? Get yourself some kind of certification that's going to allow you to make better money than chopping tomatoes, or car hopping. I was a car hop for many years at a Sonic, and I would just say, if you could look at how many hours, like at some point in your life, you're going to break a tooth or you're going to need a new transmission or something, right? And the amount of hours that it's going to take you to get that new tooth chopping tomatoes, like let's look at that picture, right? Versus if you have a trade skill like massage or something, how much do you have to work? It is so much less, so it's worth putting in the time and investing in your education as soon as like possible. So that's what I would want to fire myself up about as a younger person, is just get educated in something that other people don't want to do so that they can rely on you and you can form a business,
Is there one piece of advice that you'd like to give everyone out there who's looking to go into massage therapy or looking to start some business related to it?
Gosh, everybody's, all the massage therapists that I know are just so different. Everybody's coming from just vastly different backgrounds. What I would love to see like massage move towards is the clinical side, but there's just so many aspects that I can't really even process for the other people can do. They might have skills and things that I just can't fathom. But I would say just just show some grit and just keep pushing your understanding of what it is you want to move towards. Because, kind of what we were talking about earlier is like in this field, you can be a specialist at a lot of different things. And it just really takes a lot of time and building that network and those skills to do it. So even if I don't understand where you're going to go with it, you're going to have to spend a lot of time to get there. and dedication. So just, I think, like, find your passion and just keep plugging at it. Make sure that you're doing it every day, every week. If you're building a practice, if you're not as busy as you want to be, use that extra time as an asset to learn new skills. Right. That's so I mean, even if I'm not working 40 hours a week on clients, I'm working 60 hours a week in studying and putting together classes and things like that. So that downtime is probably worth more than my on time, if that, in the end, because I'm building my net worth. So just use your time wisely, grow skills. Yeah. I hope my nephews see this. That's what I don't want to tell myself.
Why?
Because they're about that age. So I like, I would want to convey that. I hope that they would get something out of that.
We'll tag them on this. Don't worry.
I'm sorry.
We'll tag them to this, so we make sure they see it.
Okay.
So I'm kidding. But it was fun. Thank you so much for removing the time and sharing your thoughts. It was like I was listening to a story or like a poetry. It was just so smooth. And it was good to talk to like an old friend after a long time. Yeah. I still have the business card that you gave after our workshop at the end of the day. I remember it's blue green in color.
Oh.
And yeah, I still have it.
Well, thank you. And it's such an honor that you would bring me on and get to chat. But this, there's not a lot of people I can talk about this kind of stuff with that are excited about it. So I love getting to like chat with PTs.
Thank you so much. I'll stay in touch. I'll just ping you, and thank you so much for sharing your thoughts and your views about massage, lymphatics, everything, your story. So it was fun.
Maybe bring me back in a year. I'm going to keep growing. Hopefully I'll have more stories.
Come on. I was thinking like a month or 2 months.
Oh, yeah. Okay.
Maybe we start your business online right here. You start teaching classes.
Oh, yeah. That's a good motivator for me. I need to do that. Thank you. Thank you for doing this.
Yeah, you're welcome. You're welcome. Okay. Have a good night. I'll see you soon. Bye-bye. Take care. Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.